My name is Alies Maybee, and I've been a patient off and on for more years than I can remember. And I've also been a patient partner in healthcare for about 11 years. I want to talk a bit about my vision for how I see care going forward. And I'll start with care for the whole person. And that means care that encompasses things beyond the funded system, like dentists, because after all, gum disease and heart disease are connected. And it's all connected in our bodies. So we want a system that's as connected as our bodies are. Then when we look at personalized medicine, many of us have been personalizing our medicine anyway. My sister has been for years. She cuts all her meds in half because she's a slip of a thing and the average dosage doesn't fit. The other piece of the vision that I see is care for us within the context of our lives. So that looks at things like the social determinants of health, home, if we have one, friends and family, if we're so lucky, and finances, the affordability of care. The other aspect of my vision is that we need to move more to prevention and wellness. I think most of the public is starting to move in that direction already with Fitbits and diet apps and glucose monitors and so on. But these need to become connected with the formal system. And then finally, the other aspect that I see is the practical aspect, the care coordination and navigation. I'd like online booking, especially if I'm dealing with multiple clinics in one institution. I had to hobble with my broken ankle from the fracture clinic to the rehab and back and forth last week in order to get my appointments lined up, for example. So now how do we get to this vision? We get there, I believe, by enlisting patients and caregivers to co-create that vision and to co-design the system. I think that many of us are already used to the paradigm shifts that we've seen around us. We've come along with the banking and film and so on and so forth. We're more than ready to see that happen in healthcare. And many of us who are patient partners are anxious to help. What are the difficulties for getting us to be involved? Well, first, where do we become involved? And secondly, we don't know a lot about this whole world of personalized medicine. We hear bits about AI and robotics and genomics and fragments of this and that. We hear about the risks of hacking and various things, but we don't really have a good whole picture of the benefits and a good discussion about the risks, such as they are, in the public domain. And without that, it's very hard for us to become engaged. So I think that's a very important first step. I would say that we really need a full-bore education, public education, not unlike we did with the anti-smoking campaigns. Plus we need to engage and enlist wherever we can the public, the citizens, the patients, the partners.